Good evening, one and all. I am Dr. Naini, going to present about the impact of topical adrenaline on subconjunctival hemorrhage following intravitreal injections, which is a comparative study. I have no financial interest. So as we all know that intravitreal injections are essential for the retinal diseases and the endophthalmus too. So here the most common cause is the subconjunctival hemorrhage which we are facing. So topical adrenaline acts as a vasoconstrictor, may reduce the subconjunctival hemorrhage. So in this study, we compare the incidence and severity of subconjunctival hemorrhage, post-injection pain and other adverse effects. So this is a prospective case control study which was conducted at Visakhapatnam in the month of August to September. So we have taken the population size of 80 eyes from the 80 patients, which includes the retinal diseases, and excluded cardiac patients and who have the no hypersensitivity to the adrenaline. So we have divided into two groups, with group 1 no topical adrenaline and group 2 is with the topical adrenaline, which we have given 5 minutes before and with paracaine drops too. So these are my materials and methods, which include draping and betadine eye drops and calipers and so on, 1 ml of a syringe. This is the draping procedure, and we have used 23 gauge needle in intravitreal injection, and this is the procedure which includes the initially the topical. We have done the eye wash with the normal saline, followed by betadine eye drops, and then again we have done the eye wash with the topical, and then after that we have applied few drops of topical adrenaline. Then we have proceed for the intravitreal injection. So this is the measurement of subconjunctival hemorrhage intraoperatively. So we have assessed with the use of a 23 gauge needle intraoperatively as shown here. So this is the subconjunctival hemorrhage immediately after intravitreal injection. Coming to my results, as it's a comparative study with topical adrenaline and without topical adrenaline, initially in diabetic patients we have seen the positive result of reducing subconjunctival hemorrhage of 87%. And in hypertensive retinopathy, hypertensive patients also there is a positive result of significant, which is a significant. And in CKD patients there is almost 75% of positive result. And in blood thinners, patients with usage of blood thinners also there is a significant result of almost 89%. So status of the pain in adrenaline and non-adrenaline also has the positive result of almost the 58%. So in coming to the subconjunctival hemorrhage as reduced overall almost 76.5%. And coming to my discussion, here this study highlights the reducing impact of topical adrenaline and occurrence and the severity of subconjunctival hemorrhage in our study, and compared it to the other studies, they have shown that higher percentage of subconjunctival hemorrhage according to Michael S. et al. So even the pain levels are more in other studies. We are coming to the like Kumar et al. And Christiana. Coming to the our result, there is again the lower pain, significant report has shown the lower pain levels compared to the control group. So in study, we have also focused on systemic diseases, as there is a positive effect on subconjunctival hemorrhage with the history of hypertension and blood thinners and diabetes. So my pitfalls are limited sample size, short follow-up, and there is an subjective pain reports, like pain assessment may vary by the patient perception. Coming to my conclusion, the topical adrenaline reduces subconjunctival hemorrhage and post-injection pain, especially in cases like hypertensive patients and blood thinners, improving comfort during the intravitreal injections. However, further large-scale studies are necessary to validate these findings and inform clinical practices. Thank you. These are my references.
Concentration?
1:10,000 dilution, sir.
So You're giving this topical adrenaline in
Topical.
all cases.
We have divided into two groups, sir. There is an comparative control group and one is the uncontrolled group. As this is an randomized, we have done the masking type of technique here. So almost 40 kind of patients we have taken, sir.
Because the
Almost
incidence
80.
of subconjunctival hemorrhage following intravitreal injection is not that much.
Depending on the studies, almost there is an 30% of incidence in, complication of subconjunctival hemorrhage, sir. So to reduce even the 30% also, we have used the topical adrenaline may affect the change. Because nowadays, most of the patients are like cosmetically. They are more there is creating an anxiety in patients. So to reduce the incidence, we have opted it.
I think the site is very important. Where you are giving the injections, it should be blood vessels, you should avoid the blood vessels. And
Yes,
if
sir.
at all there is a hemorrhage, a small cautery actually gives it. And this is not relevant to your study, definitely, but a small cautery actually helps. Good.
Thank you.
Thank you. And even in cases of LASIK, when you do, so that becomes significant, and we use drops like Nefem and other things. Have you tried those drops instead of adrenaline? I mean, it reduces the subconjunctival hemorrhage, which is of concern, like people going for some selection or something. So Nefem type of drops, these will almost abolish the chances of having a subconj hemorrhage. So that might also be a good thing to see.
Okay, sir.
Thank you.
Thank you, sir.